We are in another very important session relates to the welfare economy. I often observe Dhiraj when I visit in the Indian cities. I see that India's welfare policies are like a Indian city where you can see several generation of mode of transports are running in one road. You find rickshaws running, and you can find the ultra mod electric vehicles are there. This is what we are seeing right now in India's welfare politics. This whole welfare economics and politics are on an inflection point where we are seeing several generations of reforms crisscrossing each other, starting from distributing free food grains up to the direct benefit transfers and talking about universal basic income and giving free health to offering kind of doles and giving, say, loan waivers. So here we would like to understand three, four key points. What is the idea of India in terms of the welfare economics? What India is one of the largest countries in the world and emerging economy thinks generally when it comes to the welfare politics and welfare policies. We will try to understand with our learned panelist about the adequacy of these reforms, where do they reach, and how, what is the road ahead. So I will begin with the Professor Dr. Sharma. In conceptually, we are seeing multiple generations of welfare models running in India, started from giving free food distribution up to the, we are talking in terms of at least there's a discussion of universal basic income and free health care provided by the central budget. What is one model do you think has had potential to actually evolve as a model which can survive for next 5 to 10 years? I'm not saying beyond 10 years because you don't know how things evolve after 10 years down the line, but what is the model which have tested over the time and you can see that that model of the welfare policies can sustain in the future?
Yes, thank you, and very good morning to all. Uh, I would say firstly that we have a real model. You are talking about the model. We have Indian economy adopted the real model of growth, which we observed that has provided so many fruitful results. Starting from, we were very slow after the independence in 50s or 60s. Then our growth rate was steady during the 1780s. Then after the liberalization, privatization, and globalization, we were fast. And in 2000s and 2010s, we were the fastest moving economy in the world economic system. And according to various agencies, international organizations, we are the bright spot in the global ecosystem. We are driving the growth trajectory, and we are once again, after the coronavirus, fastest on the global charts. And I would say that the policy environment is totally real. We have not adopted any copy and paste in the Indian model. Our model is totally real. We adopted the globalization policy in 1991. And I believe it took around 40 years to double the income from 1950s to 1990. But after the liberalization, income is doubled every 10 years, nominal income, and 17, 18 years is the real income. So recently, starting from the Make in India, we adopted the Make in India model to enhance the trajectory of the manufacturing at the grassroots level, then ease of doing business to support the manufacturing and to support the Make in India. And we improved a lot from 142 to 63 during the recent years. And we adopted the policy of startups, which is now very, very prominent, and we are in the leading economies in the startups and unicorns. Then we adopted the policy of Gati Shakti to connect all the policy environment announced in the national infrastructure pipeline to move forward with a fastest speed so that the results are becoming fruitful at the ground level. Then we adopted the policy of Atmanirbhar, how to become the Atmanirbhar so that India is a real economy and self-reliant country, so that our trajectory, our presence in the global arena becomes more and more important. So I would say that we have our own model, which is to create the welfare state and to benefit the people. And most of the policies, I think you must have observed that during the coronavirus, the major policies started from the welfare state. And the policies were starting from the grassroots level, from the people, those who were migrated, and the policies were related to agriculture. Starting from the Atmanirbhar, firstly government announced the policies for the agriculture sector to facilitate them, to facilitate the farmers. And then policies were related to the education, then health sector, then policies for all the segments of the economy. But here I would like to mention that there must be a great synchronization of the policy environment, because policies are announced. There are plethora of policies, and this wave of policies is going to provide very fruitful results in the coming times. But we have to connect these policies at the grassroots level, at the state level, and at the district level. Otherwise, the policy environment will not be in that much trajectory, in the fruitful trajectory that we expected 4 or 5 years ago. So we have to connect all the policies at the state level, so that the welfare schemes are beneficial for the downtrodden. And the awareness is a most important parameter. If the awareness is not there for the policy environment, then the fruitful results will not happen.
Dhiraj, Dr. Sharma has talked about the economic interventions taken place in last few years. Whenever we start discussion on welfare politics, there's a kind of overlap between the income generation interventions by the policy making apparatus and welfare politics, and both belong to different trajectories altogether. Where one you are actually targeting to the needies who do not have wherewithal to survive and sustain, and the other is the overall policy economic environment, where you actually try to invite investment, put more money into the hands of the industrialist by the taxes and incentives, and expect them to create a jobs environment. So here, the whole welfare state model, which has evolved in last 5-10 years, it'll take 7 years, has got three top pillars. One is that the old generation free food distribution schemes, which were kept running, that has been increased during the COVID period. Now there's a tapering off because the cost of subsidies are growing up. India has got burgeoning subsidy bills. Despite the discussions over last many years, still we are sitting and giving an huge subsidies. Then we have started experimenting with the direct benefit transfer with the 400 odd schemes, which are smaller beneficiary sizes, and some kind of doles reaching there. These are the three top generation, and then the discussion level, conceptual level, there are some other bigger ideas which are there in discussion. So what is your experience as an economist? How do you see that, which are the possible outcomes we can see in terms of the concepts as well as in the execution side, which has actually worked and which is not worked or probably failed in last 10 years?
So, I mean, there are two things, right? There's what I call, in economic terms, we often talk about growth versus redistribution. So, size of cake versus slice of cake. So, generally, size of cake is growth, increase the size of the economy, increase the tax pie and so on. And then slice of cake is of that total size that's available of the cake, different people want different parts. So I think traditionally India over many decades, and it continues politically, is a slice of cake kind of country. So if you see when people agitate or what people want or what voters want, it's generally some kind of welfare or benefits. We don't find that kind of agitation for political salience for growth, or the income what you call the income generation type of thing. So we are a welfare oriented economy, political economy, let's put it that way. So I think the question really is, welfare is a big term. Now what in India, you said free food, which is absolutely justifiable for the people who need it most. On the other side is universal basic income. Is that an idea that India can afford, given its income level, and given that not everybody needs it? Quite clearly, a few people need it, but not everybody needs it. So I think, and then politicians come and say free electricity, free water. There's no end to what welfare can be. Everything in theory can be free. But I think what has happened in the last 7-8 years, and this remains a contested space. So in different elections and welfare is not only a central government thing; it's also a state government thing. So वहाँ पे भी people promise various freebies. Some states have a lot more, some states have less. But I think what has happened over the last 8 years certainly is that earlier a lot of it used to be wasted. A lot of welfare spending used to just go waste, taken over by middlemen or not reaching the beneficiaries. So what we have achieved, at least in the last 8 years, is that those who deserve it or those who really need it, which are the poorest sections of the society in terms of the direct benefit transfer or free food, the targeting has become much better, and technology has enabled that. 10 years ago is when Aadhaar came into being, roughly 10, 12 years ago. Before that, there was no system to identify beneficiaries. There used to be people in triplicate, dead people, all kinds of people claiming benefits. So that got rationalized. The Jan Dhan accounts have enabled, every family now in India has access to a bank account, so you can put money directly into the bank account. So between Aadhaar, Jandhan, what they call the jam trinity, Jandhan, Aadhaar and mobile phone. Again, mobile phone is something everybody has. So you can receive your benefits and you can receive information on your phone. So I think what has happened is that a lot of rationalization in terms of welfare reaching those who need it. And that I think is a very, very big and dramatic change which was not there earlier. But welfare is still restricted, and understanding and delivery of welfare is still restricted to free food or direct transfers. Whereas welfare, if you look at globally, and I know we'll come to it later, is much more than that. It extends to education, healthcare, where there is not so much attention and not so much reform yet. So we've kind of solved part of the welfare challenge in terms of getting basic needs, whether it's toilets or pensions or student scholarships or free food. But the larger point which Dr. Sharma also raised in terms of income generation welfare which enables income generation, which enables you to be healthy, which enables you to be educated, which enables you to be skilled, so that eventually nobody can live on welfare forever. Welfare means that it's a temporary thing, right? It alleviates your current situation. But in the long run, the only kind of welfare and the best kind of welfare is a productive job. So in the end, we have to look at whether our welfare policies are creating that upward mobility for people, because nobody wants to live on free food forever, right?
Dhiraj has put a perspective to it. I'll come back to the next generation of welfare reforms in India, how we are progressing to that, and where we reached from a welfare economy to the social development model of the economy, which is there and funded by that taxpayers and others. But again, I come that the DBT is an important initiative, which has actually helped in a way targeting of the delivery of the services and the money to the people, though the size is still limited. Delivery is limited to a very few beneficiaries, which are state and central scheme. Now come back to this part of that. Just keep for a moment aside the income generation part of there, where you can provide employment, we can offer good health services. If you take purely the giveaways, the benefits giving to the people who cannot afford education, who cannot afford food, the adequacy of direct benefit transfer individually in India is a big challenge in Mr. Sharma. The kind of schemes which are running a weight token like 400 rupees, 500 rupees, 300 rupees have been given to the people. If you see even the growth of these benefits which has been transferred, Dhiraj and Sharma ji both can respond on it. If you put them into inflation index, you will see that the cost of living even in the rural areas has increased the way in last 4-5 years, we are seeing 6.5% to 7% inflation average. But these benefits are still not adequate. So what is stopping them, government, to bringing some mega schemes where the benefits should be adequate rather than giving doles of 300, 400 rupees through the multiple channels? This is what the challenge which people are now started complaining about.
Yes, I would like to mention that last 4-5 years, starting from the trade war between US and China, and then the impact of coronavirus, these 3-4 years were the lows and highs. We saw the severe lows and then again the highs, and inflation was also one of them. Inflation, we saw the inflation in negative trajectory for the many months, but after that the low base effect provided the room to go it high and high again and again. As mentioned by Mr. Nayyar, that the welfare is the never-ending stage, like the improvement that never ends. So we have to provide the adequate facilities to the growing population according to their needs. Firstly, there were the need of the to remove the poverty, and then now the need is to create employment opportunities for the growing young population. We have good education system, and we have educated people, and our literacy rate is also increasing. So the main point is to provide the adequate employment opportunities to the growing young population for identifying the growth promising sectors of the Indian economy. We have to identify the growth promising sectors like food processing and the textile. We have to make them competitive so that they are able to provide adequate job opportunities. And the direct benefit transfer, as you rightly mentioned, that the focus of the government during the last 7-8 years is to remove the mediator. Firstly, that captures a big chunk of the welfare schemes. So the government is doing that, and the digitization process and the faceless interaction is one are the major parameters of the thought process of the government. That there must be faceless interaction with the government, and benefits are provided directly to the beneficiaries. And the direct benefit transfer, like the government was providing so many subsidies and all these things earlier. Now the direct benefit transfer is becoming more and more lucrative for the beneficiaries, so that, and now they are also aware. They are aware about their bank accounts, and they receive and they wait for the welfare transmissions and distribution of the things which are under the welfare trajectory. So my connotation is that it will take time, because India is a different country. We have all the segments, and we have ups and downs and lows and highs again and again, impacted by the global arena. Because India is a very sensitive country, we absorb the shocks, and we recover immediately. Like the coronavirus, we were in the 24% downturn in the first quarter of the 2021, but we recovered immediately in the next quarter. So that is the nature of Indian economy, that firstly we are impacted severely, then we recover sharply. So I would say that going forward, the schemes are very promising, but we have to create the awareness. Awareness is a major thing. Sometimes people are not aware about the government policies. According to our various surveys, sometimes the schemes, like the government runs so many schemes, like there was a scheme of the insurance, crop insurance. Many people were not aware about the crop insurance. Then soil health card. In the rural segments, people were not aware. So we have to create awareness firstly about the policies. That is the, I believe, responsibility of the district and tehsil and rural development officers. Those can provide the welfare information about the welfare schemes to their respective population.
Dhiraj, I'll come to you. Making it more precise, per capita transfers, comparatively, the globally in India, the population who's below poverty line, which is almost 27%, why they are so low when the Indian budgets are rising like in anything, if you take that?
No, but if you look at, again, money has to come from somewhere. It doesn't, and government, there's a myth about government money. Ultimately, government doesn't have any money. It's taxpayers' money. It's yours and my money, right? So the tax GDP ratio in India is 17 or 18%. Right? If you talk about comparatively, in rich countries, it's about 34%. Even in other emerging countries like China, Brazil, South Africa, it's over 24%, 24 to 27%. So India tax GDP ratio is miserable. So that itself, limits how much you can spend, because ultimately you spend on welfare, you have to also spend on infrastructure, you also have to pay salaries for government employees. So there are competing claims. So there's only so much you can spend on particular schemes. Now, in an ideal world, every time a new scheme is announced, some old schemes should be shut down, right? But that does not happen in
That's
India,
not happening,
which
yeah.
is what you are saying, right? You have all kinds of schemes going on from the 60s, 70s. They just change their names sometimes, but the schemes never end. So the ideal situation is that you start a new scheme, you start direct benefit transfers, or you start using Jam Trinity, then you get rid of some of the old schemes to consolidate and put more money into one scheme, so that the effect is more. But that doesn't happen for political reasons. It's very difficult to get rid of any old welfare scheme, because that's immediately seen as anti-poor. But that's not the case. If you want more impact, rather than spread yourself thin, which is what we end up doing, thoda thoda paisa sab scheme mein dal dete hain, but not consolidate in any one scheme. So I think that is fundamentally a problem. If your tax GDP ratio, so if you look at which are the globally you're talking about, which are the best welfare states in Europe and so Scandinavia, their tax GDP ratios will be about 50%. People happily pay 50-60% tax because government gives you everything. So in India, it gives you education free, it gives you healthcare free, it gives you pension, it gives you everything. So you don't have to worry about anything. In India, there's also an issue of state capacity. You're paying tax, but how much can the government actually deliver in quality terms? And we've seen it doesn't. So I think in India, the logic therefore remains that you tax a limited amount. We tried that extreme taxation, it didn't work. And that limited amount can only give you so much welfare. If you start, if our tax GDP ratio doubles tomorrow, if we grow and if people comply with taxation, then we'll have that much more to spend on welfare, and there's nothing wrong with it. But let me tell you this, the best welfare scheme, the best welfare in India is actually a government job, especially at the lower levels, and you see this protest on that's happening on Agnipath, it's not for any other reason. It's because a government job, particularly at entry point, the lowest level, what you call class 3, class 4, the wages are very high, and you have welfare because you get free healthcare for life, you get a pension, you get housing. No other job in the private sector guarantees you this amount of welfare, right? So even if you have, this is why there is such a mad rush कि आप जो चपरासी की नौकरी खुलती है आपकी सरकार में तो 10 लाख एप्लीकेशन आते हैं 1000 नौकरियों के लिए वो BA MA PhD so I think this is we must understand that people want, everybody wants free healthcare, everybody wants housing, everybody wants the things that a permanent government job gives you, everybody wants a higher wage than what they contribute productively, because at a lower level of government you won't even contribute that much productively. Yeah. But that's not a sustainable way of creating jobs or welfare in the country. So I think we have to think in terms of consolidating our welfare schemes so that there are few but have maximum impact. And then, as I said, there is no choice but to create better jobs outside, because ultimately, government jobs also kitne create karenge? Aap, agar Agnipath nahi bhi ho, even if the old system, there are only so many jobs being created. Right?
Government as a formal job employer as a rule is diminishing over the years. On this whole tax GDP debate, so there's a different debate, but now the people have started seeing is the tax GDP ratio in terms of the per capita income. So India's per capita income is so low, the tax GDP ratio is bound to be low. And India is highest indirect taxing country in the world. We are taxing indirect taxes, see, exorbitantly, if you the fuel taxes, if the consumption taxes, so our consumption taxes are really high. But I'm coming back to the point which you have mentioned earlier also. This thin dividing line between giving the freebies and welfares, where do we stand right now? See, in policy discourses and discussions, government trying about the restructuring of schemes. There's a lot of working groups have been made under the Planning Commission and Niti Aayog. But when it comes to the elections, we simply don't understand that the announcement in election is actually a welfare announcement or it's a freebie announcement. That's the reason, अगर आप देखें कि इंडिया का सब्सिडी बिल भी उसी तरह से ग्रो कर रहा है जितना स्कीम्स का बर्डन भी ग्रो कर रहा है और स्कीम्स की ओवरलैपिंग भी ग्रो कर रही. So what is the dividing line? Where do you find that where there should be a system that freebie should not be there? We still struggling with loan waivers. We still struggling with the cheaper power giving by the state to the people, despite we don't have money to buy the coal from our own coal India. So this is where the challenge lies between the welfareism and populism. वो उसका जो dividing line है वो क्या हो सकता है?
See, if you look at what economic theory will tell you, you should target the things which are public goods, right? Now, free electricity is not a public good. Free water is not necessarily a public good. Free healthcare is, right? Because it has a greater benefit beyond the individual that you're giving it to. Now, electricity, aapne bola. Now, that is the classic example of how the line is crossed and how it can be destructive to the economy. Every state electricity board in this country, virtually every, except for a few which are privatized, is bankrupt. We want to do ambitious things on renewable energy and this energy transition, which is all very good. But ultimately, if nobody pays for it, somebody has to pay for it, right? And if everything is free, if you and I also get free electricity and free water, and so does the person at the bottom of the pyramid, it doesn't make sense. This is why in India, I think the line is crossed when certain categories are crossed. So I think free food, free healthcare, free education, I think is important. Nutrition is important because the child has to grow up to be a productive citizen. Health is important. Education is very important. But we don't somehow stress on those. We want free electricity and free gas cylinder before we demand free education. So that is a temporary thing. It eases the burden of our pockets. It destroys the economy. And it doesn't really help our children become productive, income-earning people. So I think we have a wrong set of priorities on welfare, if I may say so. We should agitate much more on education, healthcare, skills for free, because those are what will give us income generation in the future. Whereas free electricity or loan waiver is not productive in any way.
So we are at the last sort of segment of our discussion, and I'll have two quick questions, and I'll expect two quick answers from both our panelists. Mr. Sharma, we have seen a completely new dimension of welfare state during the COVID in Europe, like say paycheck protections, giving unemployment benefits, offering direct funds to the people who are losing jobs, and that has actually created a lot of inflation in the European and American economies, but they have protected their income levels going down due to the COVID and pandemic. While that has created a new kind of welfare state model globally where you sustain the jobs. What Dhiraj was indicating is about the India's getting the job is an important problem, but in last 2 years, people have lost so many jobs which they are not coming back. So, do you think that can India graduate to the level where it can change its policies and go to the limited way to paycheck protections or something when it comes that what we have learned actually in terms of the welfare, new welfare economics from the on the global experiences?
Yes, I would, as I mentioned in my earlier speech, that we are not copy-paste the model from the European countries or the American countries, because our model is totally real to create the welfare opportunities for the many segments of the economy. So here I would like to mention that we have identified so many sectors during the COVID situation. Like agriculture sector is our most resilient sector of the Indian economy. That is going to become the another IT sector of the country, because now the agriculture exports are more than the IT exports. We achieved a figure of $50 billion during the last 1 year in 21-22. And in 1920, the figure was at around $43 billion. So going forward, we are again and again posting the new numbers, new growth figures for the agriculture sector, and the food grain production is always high every year. So we have to capture this opportunity to become a major player in the global market to create the employment opportunities for the rural enterprises, for the rural people. So that is a great opportunity for at this juncture, because there is a market of $1,300 billion globally, and our presence is still $50 billion. We are 0.5% of the total imports of the food and agri products in the world economic system. So that is a great opportunity which can create lot of welfare going forward, and this is the sector which is spread across the country, and still 50% of the population is dependent on the agriculture sector. And the second, like you mentioned, the employment creation. Employment creation will happen with the skilling, because skilling will create the welfare. If there is no skilling in the country, and we have a great demographic dividend, but we can capture only this demographic dividend if we are skilling the people. If the skilling is not happening, then we will not be able to enhance the employment opportunities for the unskilled population, because now we are going to become a more and more innovative country, and that needs the skilling and reskilling of the population.
Okay. Yeah, I will have to just wind up. I have your quick response on this. And the second is about how prepared we are for the universal basic income and universal pension kind of schemes, which is the calculations are already there on the table of the government as 2%, 1.5% of the GDP can be given. All the schemes could be subsumed in a mega kind of social welfare program, which is required. Where do we stand with two quick responses?
Let me tell you, that will not happen. Yeah. We will get a universal basic income in addition to everything else that is there. Agar hoga to I don't think that will happen, and I don't think it should be done either. But my point is, let's not look at Europe or anywhere else. The principle is simple. Give welfare to those who need it, which is probably the bottom 20-25% of the population, in terms of free food or toilets or subsidized gas cylinders or even free electricity if you want to. But you don't give it to everybody. I think that's the key thing. The targeting has to be very precise, because if you start extending welfare to more than those who need it in a country like India with its income level, with its tax GDP ratio, then you are in a situation where you're going to bankrupt states. Already a lot of states are bankrupt. Punjab is bankrupt because it gives free electricity to farmers who don't need it free. So I think one thing is target, and second is, if possible, move everything to cash transfers, because that's efficient and it goes directly into the bank accounts, at least people who will get the benefit. So I think keep welfare to 20-25% of the population. Let's not talk about welfare for the entire country, because it's not going to work. It will be a burden on the exchequer at this point. We can talk about it 10 years from now when our income doubles or hopefully even more than doubles. But I think at this point, let's focus welfare on those who need it. And for the rest of the population, let's focus on creating income opportunities, because welfare at the end of the day, at least as far as I'm concerned, is only to keep you above the poverty line or to keep you surviving at a reasonable standard. It's not for a good life. So I think ultimately everybody has an aspiration for a good life, and just stopping at welfare, therefore, in terms of giving food or free cylinder, is not going to take your standard of living above a certain level. So welfare should be only restricted. It should not be universal in India.
Thank you, Dhiraj. Thank you, Dr. Sharma. If India invests in healthcare only, with the providing better healthcare, we can generate one whole month of the productive year, productive life cycle of the people in India. That's what the research is that. Both panelists are asking, Dhiraj is not for the universalization of welfare, and Dr. Sharma is asking more investment in income generation schemes and providing welfare to that. Thank you for this, your views, and thank you for the panel joining us in the panel. Thank you, Dhiraj. Thank you, Dr. Sharma.